Okay, we
Hello.
are live. A very good afternoon, everyone. Today we have Dr. Soumya from Apollo Cradle to discuss about dengue fever, its causes and treatment. Please watch till the end and ask questions or doubts if any. Doctor, you have the stage.
Hello, good afternoon, everyone. Today we have two main important things. One is Chandrayaan and Pragyan fighting for the chess world title. But equally important is this dengue, which is causing a menace in the monsoon. Why is this become a very important thing is epidemic it has started and everywhere the hospitals are getting filled with dengue patients and admissions are on the rise. What is wrong? What are the do's and what are the don'ts which we should remember as parents, and so that we can prevent hospitalization, prevent the mortality, which is very less actually, but it can be prevented if steps are taken care at right time and if the parents know what are the warning signs. So today I am here to speak about dengue and its symptoms and the causes and how we can protect them. So, first thing is dengue is just a viral infection. No need to panic when somebody diagnoses your child with dengue infection. Dengue is caused by a virus, which there are four types of serotypes, 1, 2, 3, 4 we call, and each variant can cause same kind of symptoms. But it is unlike chickenpox or other measles viruses, which cause once infection, you get antibodies and they protect you for lifelong. But here in dengue, different serology can cause different types infections, and each infection can be worse than the previous one. That's why we are more worried about dengue, and still we are yet to find out a right vaccine for this dengue. When we have found out so many vaccines for other infections, we are not at we have not reached the goal of finding a good vaccine for dengue. This dengue is not a serious thing for all of them. It can just be dengue fever or a second type of child with dengue fever with warning signs. I'll be discussing with type of fevers like dengue A, type A child will be just a dengue fever. Type B is a fever with some warning signs. Third is a dengue fever with some hemorrhagic signs, that is severe dengue, and dengue shock, which is most critical stage of dengue. So, dengue is a virus which is transmitted or borne by a mosquito. Mosquito remains as a vector. It just transmits from one person to another person. So, Bangalore, especially being urbanized, lot of construction going on, lot of water being stagnant here and there. After rain, the mosquitoes thrive well in the clear water. It is not the stagnant water or the water which is in the drains. It is in the clear water which are stored after rain, even be it a nutshell or a coconut shell or a tire or construction building sites, whatever is there, that acts like a place where the larvas and the adult mosquitoes thrive. These mosquitoes mainly bite you in the early mornings, dusk and dawn, either early sunset side, the time, or before sunset or early sunrise. So kids who go early to school or before coming back, even in the after before the sunset, if they're going out to play, we should make sure that they are very well protected. So dengue mosquitoes usually once they are infected after biting an infected person, they are infective for lifelong. So they can spread disease from one person to another, and it is incubation period we call. If somebody is bitten by a mosquito, they can get infected starting 4 days from after being bitten, or till 10 days they can have an incubation period. Some people come back to me like, I got a mosquito bite. My child was bitten yesterday. 2, 3 bite marks I can see. Will the baby get fever today? Will the baby develop dengue? It is not so. It will take around 4 to 7 days for the baby to develop the symptoms. How do symptoms come? See, usually dengue is just a fever. So in the first thing to happen is high grade fever. So any child having very high fever, like going above 101, 102, without any focus. Initially, the most of the other flus what we see will have cold, cough, coryza, irritation, runny nose, watery eyes. These things are not there. Here there will be sudden onset of fever with high spikes, with chills, right, sometimes rigors. But child can, if a baby is a very small baby, who is a toddler or an infant, he won't be able to express the symptoms like body ache, headache. So they become unusually irritable, unusually cranky. But a child who is little older can tell us clearly that baby is having body aches, headache, especially retroorbital pain. But the more the bigger the child is, he'll be clearly pointing out neck pain, joint pain, severe muscle pains. See, initially it was called as break bone fever. It means as if your bone is broken. That kind of severe pain babies tend to develop, and smaller babies unable to express will cry incessantly. They cling to parents, they cry too much, and the older children will just restrict their movements and stop taking feed. They are irritable, they are lethargic, not eating well, stomach pain, vomiting, sometimes even diarrhea, and they might have even slight sore throat. So, first 2 3 days, nobody can tell whether it is dengue or not, but we should know that this can be dengue and try to watch the child for the next 3 days instead of worrying and doing any tests on the first 3 days, because first 3 days will not even clinch a diagnosis even if you do a blood test. So, if a type A child comes to you for 3 days fever, body aches, activity low, not eating and all, we will suspect dengue, but advise the child to give symptomatic treatment only. What is symptomatic treatment in a dengue suspected child? Is only paracetamol and lots of liquids. Paracetamol is the only thing which you give, only temperature is really high. Don't even try giving it when it is mild as 99, 98.5, because fever is not a phenomena to worry. It is a defense mechanism which body throws up to any virus. So let the body fight. Only when the child gets fever unbearable, child is looking tired and baby is getting unusually sick and delirious, then try to give the paracetamol. But always avoid NSAIDs like ibuprofen and mefenamic acid, because though they control your temperature very very well, they have their own side effects, especially in dengue cases where we suspect the platelets to go down. There the chances are high if you are giving ibuprofen or mefenamic acid. In acute, this dengue is divided into three phases. One is acute phase, where the child has febrile phase, that is the first 5 to 7 days the child can be febrile. Second is critical phase, where the fourth to seventh day, in the middle of the symptoms, right, they can go anytime. Low platelets, child going sicker is called critical phase, and then the convalescent or the recovery phase, which is after 7 days. So, first 3 to 4 to 5 days, you have to be only sure that you are treating the baby with paracetamol, plenty of liquids, watching as the baby is about to recover and it goes to a critical phase. This is the phase where the child is going to recover, but there can be chances of getting into a critical phase where the complications of the dengue develop. So we should be watchful about it. In a child who is type A, you have given paracetamol. After 3 4 days, child is okay, but get some few rashes on the body. Child starts itching, and but child is active, playful, accepting feeds well, no vomiting, no diarrhea, and child is recovering. That is almost normal. We don't even do a test. But if we suspect too many rashes, child started getting itchy, we do a blood test on day 3. What are the tests for a type A baby? If the baby comes to OPD basis, is we just do the complete blood count. Complete blood count will throw a picture whether it is viral or bacterial. Before starting an antibiotic, I see patients after 3 days they panic and they start asking us, why don't we start antibiotic? There is no role of antibiotic for a child who is suffering from a viral infection. So we just to prove that it is viral, we do a complete blood count, and then we do dengue NS1. This is NS1 is an antigen which is found in the virus, which can be detected early. The earliest is the NS1, but the confirmatory is dengue IgM antibodies. So we do that starts appearing after the fifth day and lasts up to 7 to 10 days. So we did do these tests. Some of the labs, when we do ask for a dengue panel, I've seen them doing IgG also, but when they come with IgG positive and they're panicking. See, if your child is having IgG antibody, it only suggests that your child has had an infection early and it has nothing to do with what current scenario is. So don't even panic about IgG being positive and child being having fever. So if the child's counts, what we see most of the time will be viral, which is counts being low, WBC counts are low, and platelet count will be somewhere mild to moderate. That is 1.5 above, we don't worry, but we tell the parents about warning signs. So a child who is well and almost recovering, what are the warning signs the mother or the father have to look for the next 24 to 48 hours? Is the fever, after fever reduction, is child unusually tired, urine output is going down, unusually starts crying, telling severe stomach pain, starts vomiting, says he is giddy and unable to walk around, and he says urine output has gone drastically down. These are the signs that the child has got into a critical phase where there is leaking of capillaries. So these are the children where we again repeat several tests. So warning signs, if nothing is there for a type A baby, symptomatic treatment, plenty of liquids to protect the baby from further worsening of platelets. Even if there is mild platelet decrease, we need not worry. So platelet up to 50,000, we really treat on OPD basis. Below 50,000, we and with other warning signs and dangerous signs, what I've explained, then only we think of hospitalization. So if a child is having a platelet count of 175,000, 1 lakh, and child has itchiness and child is otherwise stable, eating well, drinking lots of fluids, he can be managed at home, giving plenty of liquids. Every hour, if you give a glass of 100 ml of liquid, be it water, clear water, tender coconut, ORS, and all the fruit juices, that's more than enough. Avoid giving spicy food or very junky food, fatty food, which can increase their acidity because already they have gone through this ulcer. There will be dengue will cause suffusion of all the internal organs also. So they won't be able to eat well as before. So don't try to overload the baby. But instead, you give small frequent feeds so that he's hydrated well, urinating well, active. Itchiness will be reduced by giving some anti-allergy medicines and some local applications and multivitamins. If a type B child who has developed warning signs, then we are more careful about it. We might repeat the platelet count. If the platelet count has dropped drastically from 1 lakh to 50,000, these are the children we admit. Why we admit? They are not going to take orally, and this is the stage critically where the capillary starts oozing water. Liquid is there in the blood, blood which starts leaking from the intravascular space to the extravascular space. So here the child starts getting tummy pain because you are losing water into your stomach, and you start becoming breathless because your liquid is oozing out to your lungs, and around the space is called pleura. And child here starts breathing fast and taking the baby has severe abdomen pain, vomiting, like drowsy because your sodium potassium imbalance happens because you're losing some water, and sodium can go down. Some babies can throw a fit, some babies can have bradycardia, heart rate going low, or high heart rate. This is the stage when BP starts coming down. So any child who comes to your OPD, it is ideal to monitor their blood pressure, be it in the OPD basis, even with warning sign or without warning sign. And also, if they have giddiness, dizziness, better monitor blood pressure. If a child is having low BP with signs of warning signs like stomach pain, vomiting, giddiness with fluids, we go for admission and then you do the further test. For such babies, we not only do the CBC, we also do hematocrit. There, it will tell us how bad your blood concentration is because you're losing blood through the capillaries. So your hemoglobin concentration, that is PCV, we call, that starts raising. So when your hematocrit raises, your chances of bleeding everywhere, all your other organs getting affected other than the capillaries, your lungs, liver, and kidneys, and the whole generalized metabolism starts getting worsened up. And this is the stage we try to pick up things with early and try start giving IV fluids in a more rapid rate than what the oral intake can be. So such needs to be hospitalized, and in case platelet is dropping less than 20,000, 10,000, we keep them in ICU. These are the kids who are severe dengue. So these are the type 3 people whom we shift to ICU. So any child in type A, type B, do not panic. Type A, you just stay at home, keep the baby rehydrated. Type 2, keep in the hospital just to monitor the platelet and to look out for the warning signs so that it doesn't worsen. Type 3 are the ones which go for dengue hemorrhagic fever. Type 4 is the dengue shock. These three C and D type of patients are the ones to be hospitalized. Yes, we have to panic. Otherwise, you have to be in continuous vigil and you have to watch for the urine output and be calm. And if you're apprehensive, then the child cannot be managed well. The type 3, type 4 will be managed with IV fluids, and if needed less than 10,000 only, the WHO has recommended to give platelet transfusion. Otherwise, I have seen some hospitals giving patients admitted and with 50,000 and all, transfusion not needed. And we recommend, we sometimes give plasma, whole blood, based on how severe the infections are. Here we also look out for liver function tests, kidney function tests, renal functions to roll out whether your kidneys are filtering well, urea creatines might go high, electrolytes may go haywire. In such cases we have to transfuse. And these are the kids who start developing spontaneous bleeding. So till then there won't be any bleeding. Even if there are rashes in type A and B, there'll be some flushed red thing on the face all over the body. When you press, it just blanches. These blanching type of rashes all over the body is okay. But when they start getting warning signs, when during recovery, what happens? Your baby is warm elsewhere, hands and limbs get clammy and blue. So your peripheral circulation is getting hampered. Such kids also we just manage with oral fluids. But if your cold clammy hands are getting worsened, pulses are getting feeble, BP is going down, then we start administering IV fluids and colloids. But what happens if they start developing spontaneous bleeding like nosebleed, gum bleed, rectal bleed, stools also, vomiting with blood? These are dengue hemorrhagic fevers. So in such cases, we give extra care in the ICU. So only 1 in 20 children will develop this dengue shock or dengue hemorrhagic fever. So don't think of the complications when your child is diagnosed as dengue and start finicking and doing platelet count every other day, every day. So after each day they do, even if symptoms are not there, even if warning signs are not there, don't prick your child unnecessarily. So do it only when your physician advises. And see, this is a preventable disease. How we can prevent? Thank God that it is not contacted by a person to person, just like COVID, and it is always a vector-borne disease. So we have a choice of keeping ourselves, around surrounding hygiene, environment clean, modification of your surroundings, and those things can play a major role. If your child is going to a school, so always send full covered, and pants and full sleeves should be put. And you can apply those patches on the dresses, but I would not recommend a spray or anything in the rooms. Anti-mosquito repellents only those who are permitted by the environmental protective agency, EPA, that is DEET, is a good anti-mosquito repellent that can be used. Neem oil and lemon oil, eucalyptus oil, these are also organic insecticides or repellents. You can keep them under the cupboards, under the cots, behind the screens. These are the dark places where the mosquitoes thrives. So keeping our house clean, and even the body odor of the baby, if they're sweaty, they get attracted by the mosquito. Make sure your baby's skin hygiene and the general hygiene is well kept. Surroundings, mainly as I told you, they thrive in clear water. So keep your house surroundings clean. Keep all the containers, especially even the drinking, some bowl of water, if you have left it not covered, it can thrive as a it can help the mosquito larva and eggs to proliferate. And every pots, if you are having a pot with a plate, you have to clean it every other day or every day if possible. So keeping and if you have detected somebody has a dengue in your locality, please inform the municipal authorities. They will come and do the fogging. And it has to be, it's a public problem, so you have to inform the government authorities to take care. Otherwise, anybody in your house, if you have dengue, and if the dengue you have got bitten by a mosquito, it will be spreading to others, because that same person being bitten and the other normal person also will develop. So make sure if you are in a same house with many people around, you are taking precautions so that mosquitoes don't bite you and spread it to the others. And thus taking care of all this and knowing the symptoms, we will be able to control dengue and treat dengue in a right way, and protect children from going into a sick phase of being type 3 or type 4 babies. And do's and don'ts is never use, again to highlight, don't panic, don't use ibuprofen or mefenamic acids. Do not do a test before 3 days of after 3 days of onset of fever. Only after 3 to 4 days only please do the blood test. And don't have to administer admission, do the admission for every dengue child. And stay home, stay safe. Take care. Any questions are welcome. No questions. You can finish. Thank you. Done.